Hello everyone, Namaskar. I'm Dr. Sanjay Misra, medicine consultant from Delhi. In this video, I will be talking on a simple thing like dog bite. So, dog bites are common and many of us know, but let us be clear what to be done. The first thing I want you people to print in your brain that rabies is 100% fatal but preventable. So no one who gets rabies is treated. So it is 100% fatal. There is no way out. So prevention is the only measure that can be taken. So keep this in mind. So which animal bites cause rabies? People come, well, it was monkey, well, it was a horse, it was a cattle. So rabies affects only mammals. Mammals are warm-blooded animals with fur. Example, dog, monkey, cattle, cats, rats, and bats. Now, different geographical location has different percentage. Like in US, rabies from dogs is only 1%. Whereas in India, rabies is 97% from dogs. So that's why in India, majority is from dogs and cats. So bite from rats and bats are not advised to get vaccinated. It is very rare. But in US, if you get a bite from bats, you have to be vaccinated. Any contraindication? Any people who cannot take vaccines? Well, I told you in the beginning, it is 100% fatal. So there is no contraindication. Maybe pregnant lady can take, a 1 month baby can take, a lactation mother can take, any disease on dialysis, any disease of any person at any age, vaccination is the only way out. What is the first aid that is required? Well, we have to manage the bite site. That is one management. And we have to tackle with the virus which comes along with the animal bite. So that can be tackled with active immunization and passive immunization. We will see. But this first aid will depend on the category of the animal bite. This is very important. So what are the categories? Well, animal bite category 1, it is just like you pet a dog, you pet a cat, you feed a dog, the dog or cat licks your skin, which is not cut anywhere, which doesn't have any abrasions. Those are considered as category 1. So nothing is to be done. So this is to be kept in mind, that licking on a intact skin is not considered as any danger. Well, animal bite category 2, nibbling, licking a cut wound that you have on the skin, minor scratches or abrasions that animal cause due to with their tongue, with their teeth, or with their claws. Both will be considered, and without bleeding. So with blood, it goes in the third category. Without bleeding, there is a scratch caused by the teeth or nails of a mammal, will be considered as an animal bite category 2. What are the things to be done? Wound management and anti-rabies vaccine. Now let's see the most dangerous category, that is category 3. It is single or multiple scratches with blood or licks on the broken skin. Leaking of human mucous membrane is also considered as a third category. So we should be careful. We can see due to love and affection, pets do lick the mouth and mucous membrane of their owners. So it should be very careful. So what are the first aid? Well, wound management and anti-rabies vaccine stays the same. Another, rabies immunoglobulin has to be added. What is an immunoglobulin? It is a basically prepared antibody. If we give anti-rabies vaccine, the body will prepare the antibody. But rabies immunoglobulin is the prepared antibody. So this is a category given by our national guidance of rabies prophylaxis. So these three categories. So let's come to the first aid that is to be given. Wound management. Well, first we have to remove the virus as fast as we can and as much as we can. This can be done by immediate starting wound wash with soap and water. If you can find soap and water anywhere nearby, well, just flush it with high stream of water. That will do. But doing nothing is not a good idea. So in this way, virus can be removed. Soap is compulsory because the saliva of animals contains fat and the fat is sticky. So to remove the stickiness and the virus along with, we have to use either soap or detergent. Detergent is not advised, soap is required. What are the ways to neutralize the virus? Well, the superficial can be washed away by soap and water. The virus which are stuck and which has entered somewhat can be even neutralized by rabies immunoglobulin. So these are prepared antibodies that we have to give in and around the wound. And with that, tetanus and antibiotic prophylaxis, because if the wound is big, then we have to give antibiotic. What are the don'ts? This we should also be knowing. So no applicants of irritants like chilies, oil, turmeric, lime, salt. Some people add soda on it. So this will just irritate the wound and it will increase the spread. So it will do damage rather than protect. No suturing of wound. It is no stitches on the wound. If required, after a few hours, after infiltration of that immunoglobulin, it can be done. Because if the wound is big, people come with monkey bites, with big wounds. So it just has to be attached with the minimum suture required, the minimum stitches required. This is tricky about rabies immunoglobulin. The dose is 20 IU per kilogram. So a 70 kilo would be requiring 13 to 1400 IU, and one vial contains 300 international unit of the dose. When should be given? Well, the sooner the best, first 24 hours, but it can be given till 7 days of the bite. So how it is done? If it is a big wound, it is infiltrated around the wound. If it is a very small, just a prick, then the amount which can be given in and around the wound can be given. The rest can be given as an IM injection, but it should be a different and far away place than the place where it is vaccinated. Cost is a bit, yes. One vial costs 7,000, and if 4 or 5 vials are required, then the cost comes to around 20 to 30,000 rupees. So one should be knowing this, because this many hospitals provide, and then people try not to take it. So if you know that this is a requirement, you should be taking it, because the first line what I told, there is no treatment, 100% fatal. So that we should keep in mind. What are the rabies vaccination types? Well, the one is like after the bite, that is called post-exposure prophylaxis. There are veterinary doctors, veterinary staff, where they deal with mammals everywhere. there are farmers who deal with cattle everywhere. So they can go with pre-exposure prophylaxis. And there is a third category called re-exposure vaccination. Suppose someone got a dog bite in the childhood, and then after 10 or 20 years or 30 years, he or she gets a dog bite again. So what would be the regime? It is not a full regime. So let's see, rabies vaccination. The preferred location is arm for adult and thigh for infant and small children. So what are the regimens that is being used for different types of exposures? So post-exposure, if first in life there is a dog bite, the regimen would be 0 day, the day of the bite, 3rd day, 7th day, 14th day, and 28th day. That's a 5-dose therapy. For pre-exposure, well, there is a regime 0, 7, and the 3rd dose can be taken on 21st or 28th day. What about the re-exposure? For re-exposure, only 2 doses advised, 0 and 3. And no immunoglobulin is required in the re-exposure, because there is already a baseline of immunoglobulin in the body, because the person has got vaccinated, provided it is not only that a person has got dog bite. He should have taken vaccination in early childhood or in previous years. Only then it will be termed as re-exposure vaccination. So I hope that you came to know something new, and it is valuable your time, and please spread the awareness and make people know what are the types and what are the complication that it is 100% fatal. This everyone should keep in mind. So thank you everyone. Namaskar.